Hi folks, this is Declan at Pendulum Physiotherapy, and I thought I would do a little video today because I had a call from my friend Lee. Now Lee is a combat sports person. He does MMA training and he does some boxing, and he's got a fight coming up. So Lee has a wrist injury which he wanted to talk about taping. Unfortunately, he's not able to come into clinic. So I promised him I would try to give him a little instructional video, and I thought, hey, look, let's share it with everybody else. So we're going to talk about trying to tape your wrist for sports like rugby or sports like boxing or sports like MMA. Now, any wrist injury, you generally want to make sure that you don't have a fracture in there if you've been part of a combat sport or a trauma sport. So usually getting a set of x-rays is pretty important in terms of if you sustain trauma and you've any sort of continuous pain or any obvious signs of swelling. It's pretty important to rule out a fracture first. Once a fracture's been ruled out, we can have a physiotherapy assessment, and if your physio is more than happy for you to go back into sport, well then we can talk about taping for protection. Okay. Now we do have to be wary of, there's a nasty little guy in here at the base of the thumb called the scaphoid. And the scaphoid is a little oblong bone. Because of how blood flow passes through this bone, it can be a lot of trouble for somebody if you damage the scaphoid or fracture the scaphoid. You can have a lot of trouble trying to get that to heal or making sure that it doesn't re-injure itself. So always really important to talk to either your orthopedic consultant or your physiotherapist about whether the scaphoid is involved in an injury in this zone here on the thumb side of the wrist or at the very base of the thumb. Okay, because the scaphoid can actually die if it's been broken down at center. Sometimes you need to have an MRI scan of the scaphoid to make sure that it's definitely not injured. So again, speaking to your physiotherapist or your orthopedic consultant or your fracture doctor to make sure that that's not the case. In the next clip, what we're going to do is we're going to look at how, if we're sure that those things aren't injured and we're confident that this is, say, some cartilage injury or some sort of joint injury or some muscular or tendinous injury in near the zone, that we're happy that is safe to progress back into some sport, well then we're going to look at some nice taping strategies. Right, so we're going to start with looking at what you're going to need. So we're going to need a pair of scissors for cutting tape. Going to need some EAB, elasticated adhesive bandage, which is this nice sort of softer stretchy stuff, and that's 5 centimeter. Then you're going to need some zinc oxide tape, 5 centimeter, 3.8 centimeter, 2.5 centimeter. So you've got a lovely sort of large, medium, small in zinc oxide tape, which is a stiff white sports tape. Sometimes it will come in a brown color, but it's a non-stretchy, very sort of robust sports tape. Okay, so the next thing that you need to know is if you're doing this by yourself, it's quite hard to tape with just one hand. So I'm going to be taping this hand with this hand, and that's quite tricky. It's not something I'm used to, but I'll give it a shot. It might not be as neat or as tidy as I would normally do when I'm taping the athlete with my 2 hands. But we're going to start with this 5 centimeter elasticated adhesive bandage, and that's really nice as sort of a stretchy base that gives support. It's also quite good on the hairs, so hairy hands, hairy wrists. This stuff isn't quite as unpleasant as the other stuff coming off. The zinc oxide tape will give you a good waxing when you're done. So nice base on the wrist, just getting it on to the beginning of the hand, and then a little cut. And we'll stick that down. So we've got a base. I'm probably going to need a sharper pair of scissors in a moment, but we've got a base. So on the base, we're going to put down a little bit of zinc oxide tape, a little bit of the firmer stuff. And now I've got a nice normal wrist strap, okay, like you would wear, say, normal day at rugby, normal day at GAA, you might wear a wrist strap like that. So now what we want to do is we want to integrate the hand onto the wrist strap. So we're going to take a little bit of the small stuff, big wide web of a hand, and we're going to go from that point across the whole palm, really, really wide. Now, what we're going to do is we're going to link that to the thumb, okay? And finish on the wrist. So we have a little bit of tape that's gone around the palm, around the thumb, and it's finished here on the wrist, okay? Smudge down any bubbles or folds, okay? So now we have a link from the hand to the wrist. We're going to take a few of these sort of middle-sized pieces and we're going to make some strips of tape down the hand. And repeat. Try to avoid any folds or bubbles best we can. It's a little bit messy. Okay. Change the angle for a couple of those strips. Try a couple of X's. And then the same on the other side. We're going to do a couple of strips down that side of the hand. I'm using my teeth. You do whatever you feel you can. Okay. So now we've got some pretty good restriction, okay? We've got some straps going across this side, some straps going across this side. Now we're going to go back to the small stuff again. So we're just going to bolster up what we did with that first round the thumb, round the palm thing. So we're going to go round those things again, okay? Spread the hand nice and wide. I'm going to go around the palm, down onto the base of the thumb, around, and go back to where we came from. Around the thumb. And now we can use that tape to start curling around the wrist. Okay, so we've got a lovely locking around either side of the thumb, around the palm, around the thumb, around the palm again, around the thumb the opposite way around. And now we can finish with that big stuff right on the bottom. 5 centimeters zinc oxide. Wrap it up, not too tight. You don't want to cut off blood flow to the hand. And we're just finishing on the base of the thumb. And you should be left with a nice wrap that leaves your fingers and thumb free to move. Plenty of movement. You can make a fist. You can obviously throw a nice punch. Well, if you're Lee, you can, not me. But that is a lovely way to protect that wrist from re-injury. You can fall on it, it's not really going to impact. You can take a nice blow through it. It's not guaranteed to prevent injury, but it's going to reduce your risk. And that's your taping.